Over at the Statehouse, we were asking questions and asking you this question. Have you ever heard of a substance called kratom? Some people call it a supplement, others say it's a drug, and it really has grown in popularity over the past few years. Researchers say people use this particular drug as a pain reliever or as a stimulant. And you can buy it, some say nearly anywhere, but a new bill just signed into law is aiming to put restrictions on this particular drug. And experts say they could have known that their unknown side effects are causing some serious problems. Our Josie Frost joining us at the Statehouse with more details.
A handful of states have already outright banned kratom, but this bill aims to regulate it and keep it away from anyone under the age of 21. Experts say until there's more research, it can't be so accessible. In smoke shops like this one here in the Midlands, you can find kratom in powder, pill, and even liquid form. You can also find it in some grocery stores, sold as supplements. Senator Russell Ott says he was inspired to file this bill years ago after his constituents raised concerns.
They had a family member that was using kratom that they felt like had led to a lot of problems, a dependency on kratom. And they said they just didn't think that it was good stuff and that they had looked into it and there were no laws whatsoever in the state of South Carolina.
The product is not FDA approved, and the DEA lists it as a drug or chemical of concern, but not a controlled substance. The law would outlaw selling kratom to anyone under 21 and require it be kept out of reach, meaning it would have to be behind the counter or secured in stores. Sean Arendt is a professor at USC's Arnold School of Public Health. He's working on research on kratom. He says while it can be harmful at high levels, in lower doses, the effect can be similar to what's seen with caffeine.
Where it appears that most of the addictive issues come in, at least based on the evidence that's available, is with frequent use, more than 3 times per day, and with doses above 7 or 8 grams at a time when we see that.
Arendt says there's a compounded form called 7-hydroxymetragenine that appears to be more addictive than opium.
And that makes it much more challenging, and I think that's where some of the legislation is actually targeting, is to prevent these synthetic compounds showing up in an otherwise natural substance.
Arendt says he's working on research on the potential harms or benefits of kratom in low dosages. This law will take effect in July. Reporting at Statehouse, Josie Frost, News 19 WLTX.
Josie, thank you.